10 symptoms of dangerous diseases ignored by many women. As a woman, you are undoubtedly preoccupied with your job, family, home, and everything in between. It is all too common to neglect or postpone taking care of your own needs. However, when it comes to your health, it is critical to prioritize yourself. However, there are some signs and symptoms that need to send you on your physician without a second hesitation. Paying attention to seemingly little concerns can sometimes avert a trip to the ER or discover more serious conditions. So, when should you go to the doctor? Here are 10 symptoms of dangerous diseases that are usually ignored by many women. Number 10. Chest pain. That piercing sensation in your chest might be a heart attack, like the one shown on television. So, if you experience a squeezing sensation in your chest, immediately call the hospital. If the pain is less severe but tends to persist, you should also contact your doctor. Furthermore, don't assume that a heart attack is always felt in the chest. Back discomfort, nausea, jaw pain, or excessive weariness, such as being unable to make your bed without taking a sleep, may signal that your heart is in trouble. If you are experiencing any of these symptoms, contact your emergency services and report that you are suffering a heart attack. Have you ever faced any of these problems? How did you find it, and what was the treatment? Please feel free to share in the comment box, because from your feedback, others can be benefited. And if you have anything regarding this episode, feel free to share it with us. We try to reply to every comment. Number 9. Extreme head pain. Call emergency services immediately if you have a headache that comes on unexpectedly and is the greatest headache you've ever experienced. You might have an aneurysm, which is a weak spot in the wall of an artery that supplies blood to the brain. The discomfort is caused by an enlarged artery pushing on your brain. If it ruptures, you might have a stroke, or worse, die from a brain hemorrhage. This is not a migraine, although it can cause comparable symptoms such as vomiting, light sensitivity, and fainting. However, the agony in your brain will be so intense that you will be unable to endure it. Call your doctor if you start getting headaches on a regular basis. These might be symptoms of a brain tumor, vision problems, or a variety of other conditions. The emergency is not as severe as an aneurysm, but your doctor must rule out other possibilities. Number 8. Changing skin. Have you observed a change in the color, size, or form of a mole or freckle? If this is the case, see a doctor immediately. These skin changes might be melanoma, a dangerous kind of skin cancer. Fortunately, if detected early, it can be successfully treated. Make skin self-exams a regular part of your regimen, much as breast exams. You will be able to tell if something isn't correct this way. If you haven't had a full-body skin inspection in a while, make an appointment with a dermatologist or your primary care physician for a skin cancer screening. Number 7. Numbness in your hands or feet. If you experience numbness, weakness, or tingling in your hands or feet, or if you have lost strength and are having difficulty ascending the stairs, you may have a herniated or bulging disc in your spine that is pushing on a nerve. And that nerve might be damaged. If the pressure on the nerve is not relieved, it may result in permanent neurological abnormalities or damage. To explore treatment options, contact an orthopedist or a neurologist. A doctor would usually wait to see whether these symptoms go away on their own. And in the meantime, you may require physical therapy, non-steroidal, anti-inflammatory drugs, alternating heat and ice, or a cortisone injection. If these therapies are unsuccessful, you may need surgery. In any case, don't waste time trying to get attention. Number 6. Leg pain with swelling. If you observe swelling in your calf, along with painful soreness, contact your doctor or go to the local emergency room. This demands quick treatment and should not be delayed. The symptoms point to a blood clot in your leg, which is a serious disease since it may be fatal if the clot breaks loose and travels to your lung. According to the Society of Interventional Radiology, which records such numbers, pulmonary embolisms kill around 200,000 individuals each year. The clot may obstruct the delivery of oxygen to your lungs. However, if treated promptly, the death rate is less than 10%. Patients with a history of blood clots are particularly vulnerable, but anybody who has been motionless for a long period of time may acquire a blood clot. That's why during lengthy flights, it's a good idea to move about the plane. Other symptoms include shortness of breath, leg discoloration, more visible veins, and a heated area on the leg. Number 5. Outsized fatigue. Everyone's energy level varies, especially as they age. However, if you find yourself suddenly unable to keep up with the speed of your life, your body may be trying to tell you something. Your doctor can perform an anemia test on you. You might have Lyme disease or cancer. Your hormones may be out of sync. It might be a symptom of a heart attack. In any case, don't overlook it. Consult your doctor to rule out any underlying reasons for your sluggishness. It might be a minor problem that can be fixed quickly, so you'll be back to your old self in no time. Number 4. Abnormal pain during sex. Is lovemaking no longer as delightful as it once was? Pain during sex can be caused by a variety of problems. Endometriosis is one to be aware of since it can lead to infertility. Endometriosis occurs when tissue that resembles the uterine lining begins to develop outside of the uterus. In addition to painful intercourse, keep an eye out for pelvic discomfort, extremely painful periods, and pain when you go to the bathroom. It can easily be treated by hormone therapy. Number 3. Heavy painful periods. You are aware of what is usual for you in terms of your monthly cycle. If you are having unusually heavy or painful periods, it is time to contact your doctor. These symptoms may indicate gynecological issues such as uterine fibroids, which are the most prevalent non-cancerous tumors in women of reproductive age. There are therapies available for uterine fibroids and other gynecological conditions that cause heavy or painful periods. Number 2. Unusual discharge of the nipple. It is critical to keep an eye on your breasts. Watch for nipple discharge in addition to lumps or changes in breast size or shape. Breast cancer can be detected by discharge, especially if it is red or clear. Do not put off seeing a doctor. Number 1. Abnormal bleeding after menopause. If you have bleeding between periods or after menopause, see your gynecologist as soon as possible. Abnormal bleeding can occur for a variety of reasons, including gynecological malignancies such as cervical or uterine cancer. Endometrial hyperplasia or thickening of the uterine lining is a non-cancerous cause of irregular bleeding. This problem can happen to anyone at any time, so if you observe any of these symptoms, do not hesitate to see a doctor. Keep in mind, a stitch in time can save 9. That's all for today. Hope you have enjoyed our video. For more interesting videos, please subscribe to our channel, Hope to see you in our next episode. Till then, goodbye and take care.